Hi, and thank you for giving me opportunity to explain about my project regarding the risk management. My name is DHEVAMANI and my lecture's name is Dr. Sohaila. For this project, I choose TechCorp Sejahtera as my company. This company is basically a technology company that focus on the cloud computing, AI-based software solutions, along with the innovation in digital workplace. This is mainly collaboration with the tools, automation, and AI-driven productivity workforce in several nations. So it's basically demands with the customer's care. Some more, this is the organization chat for my company. Basically, the main one is the chief executive officer, following chief operating officer, chief technology officer, chief financial officer, and some of the HSE team. The most critical ostrich that I found in this place is in the TechCorp's digital work environment. It's a remote collaboration or AI monitoring for the cloud computing. The primary risk I found in this one are digital overload workforce. So by excessive digital overload, that can be excessive screen time, connectivity, some of the blurred life boundaries, and AI-driven performance tracking. So this can lead to a physiological strain. And some more with the 62%, I found a 62% burnout symptoms, and some more with the 41% of the performance monitoring, fear of performance monitoring, and lack of autonomy perceived. This also impact the organization impact productivity and increase the turnover. So for the digital overload, and this was is my flowchart. I'm coming up with the coverage for each subdomain of the risk management. For scope, I found the boundaries and the risk assessment for remote work, digital monitoring, and excessive screen time. For context and understanding the situation where is the happen of the while doing their works. Some more with the criteria. It's basically meet with the standards of ISO 330-1000 2018. For risk assessment, I focus on the identification of the health risks such as AI-induced and anxiety of work-life imbalance. Scope remotely covers of the employee's hybrid boundary physical safety risk. So this one is outcomes come with the control measure implemented by identify the risk to reducing unidentified emergency stress patterns. So TASCOF's also commitment with the entire occupant safety in health to demonstrate the amount of risk identified in their workplace by surveys, feedback loops, and promotion of the remote teams. To clear the boundaries, they meet with the psychological and non-digital physical dangers. Um, they also conduct the measure like of WHO 5 well-being index are chosen. For risk treatment, we basically focus on the implement control measures such as break scheduling, software restriction, mental awareness, and scope for the applies employees for using company AI software such as working remotely or subject to digital surveillance. The boundaries I found in this one is exclude the roles without a regular screen exposure. So for the outcomes I found from this one is reduce the stress-related absenteeism and satisfaction. So for the communication and consultation, I gone with the team check-ins, digital settings, and for scope for regular digital town halls and boundary company-wide communication. For recording and reporting, documentation, digital stress, scope for full-time remote and boundary health data from outside. Monitoring and review, focus on the check-ins and our AI surveillance. For scope, cover all departments using their productivity. For boundary, using a team without a computer-based work maintenance. That's all from me. Thank you for hearing for my points from my project.